All right, so now you've been introduced to evidence-based medicine and some of the early features of complementary and alternative medicine. So now that you've had that introduction, I want to start focusing on how to increase your health span, or if you're going into a medical care profession, how you can help your patients also increase their health span by using integrative medicine. So first, we're going to talk about the four horsemen. So to do that, we need to take a look at the leading causes of death. And for that, I'm going to jump to this website. All right, so this website gives us a snapshot of the last couple of years from March 2020 through September of 2022. I think they wanted to overlay the COVID pandemic, and so that really started in March of 2020 when we closed everything down and had our first real wave of COVID. So you can see the COVID death rates here. If I just click on there, you can actually take it out or put it in, right? And so clicking on this is a really nice, cool interactive map that lets you really highlight the type of death rate that you want to take a look at. So what you notice here is that infectious disease, as far as COVID-19 deaths, has really played a prominent role in death rates over the last couple of years. Much more prominent than we have seen infectious disease play in the last several years. But it should be known that other infections are generally in the top 10 leading causes of death within the United States. These are lumped together as respiratory diseases like things like influenza and pneumonia that cause quite a few deaths as well. So you can see that they contribute to leading causes of death in the United States as well. However, our leading causes of death within the United States usually every year are these chronic diseases. So things like heart disease is a chart topper. Cancer also very much up there. And then a little bit lower, you see things like Alzheimer's disease or dementia. And then metabolic disorders like diabetes. The other one that you can see up there as well are accidental deaths. So these play a huge role, especially for people at younger ages. Accidental death is quite high. So if we're able to reduce accidents, that could greatly reduce our death rates as well every year. So these top four diseases of aging, or these chronic diseases, are termed the four horsemen of chronic disease by Dr. Peter Attia. And he is a medical doctor that has focused a lot on trying to increase his patients' health span. And so he kind of takes this approach of trying to use Western medicine as a base and then layer onto that integrative medical practices that can help people achieve longer life, but not only longer life, but longer life with better health, right? Because you don't want to have chronic disease and just extend the time frame that you are feeling terrible, right? You want to live a long time, but you also want to live well. So these four major diseases of aging that cause the most deaths, about 80% of the deaths in people over 50 who do not smoke, are caused by heart disease, cancer, neurodegenerative diseases, including Alzheimer's, and type 2 diabetes and other related metabolic dysfunctions. So if we can try to use our tools to help us reduce the impact of these diseases, we can greatly increase our health span. So what exactly is health span? And how does it differ from lifespan? So health span is the amount of life that's spent in good health without disease or age-related disorders. Lifespan is only the duration of the life lived, right? So we really want to increase our lifespan, but we also want to increase it with an increase in our health span, right? You want to have these three features down here that are going to be preserved as you age. You want to preserve your cognitive health. You want to preserve your physical or your structural health, right? So a lot of people as they age will get things like arthritis, lower back pain, joint pain, and other chronic aches and pains that really make their life quality go down, right? So you want to avoid those types of things. Osteoporosis would be another big one. And then this third section is mood and mental health, right? So loneliness in our country right now is really on a high trend, and this can really impact your lifespan and your health span as well. So, paying attention to mood and mental health is also an important aspect, and that's becoming better recognized in Western medicine over the past few years. And hopefully, we will continue to do a better job here. So, how can our lifestyle choices and habits help us increase our health span? Or if you're going into the medical professions, how can you help your patients gain in their health span by helping them make smart lifestyle choices? So, I like to use the acronym NESS as a foundation for the major things that can have the greatest impact when we're making our lifestyle choices and choosing what habits we're going to get into, right? So the N stands for nutrition. And I've also put supplements up here because we're going to cover some of these as well during the term. But nutrition plays a key role, and we'll talk about the important concepts in there. Exercise, foundational. If you take two things away from this class, the exercise component is critically important. And then this next one here, the social connections and your sense of purpose. This kind of plays a supersized role in your lifestyle choices and in health span. And we'll talk more deeply about that in two areas. There was a Harvard study that it's actually still going on that has followed generations of people now to see who has the greatest health span and what factors in their lives are most highly correlated with that health span. And we're going to see that social connections make a foundational impact on health span. The other two S's in there are for sleep and for stress. And these other two areas also play critical roles in health span. So we're going to start our journey talking about stress over the next probably week and a half, and then get into these other concepts, maybe jumping around just a little bit into exercise next, and then talking more about social connections and our sense of purpose, up into nutrition and then supplements, as well as looking a little more deeply at sleep. No pun intended there. All right, so in the next section, we will get started with stress.